Exercise epidemiology has been defined as the study of factors associated with participation in a specific behavior, that is, physical activity, and how this behavior relates to the probability of a disease or injury. A central tenet of exercise epidemiology is the fact that participation in regular physical activity affects one's risk of developing certain diseases. Exercise epidemiologists are primarily concerned with studying who exercises, what they do, and when, where, and why they do so. They seek answers to such questions as, to what extent are individuals within a particular society or culture physically active, and in which physical activities are individuals most likely to engage. They may also study variations in physical activity patterns across certain groups based on race, age, sex, socioeconomic status, and so forth.
Exercise epidemiology date back to the ancient Greeks, who recommended vigorous physical exercise as treatments for improving the mental health and overcoming physical illnesses. Joseph Duchenne and Thomas Cureton were two of the main contributors for the foundation of exercise epidemiology, along with other various scientists and physicians. That individuals involved in occupations that required large amounts of physical activity were less susceptible to coronary heart disease, cancer, type 2 diabetes, osteoporosis, osteoarthritis, and obesity.
Cardiovascular disease, also known as CVD, accounts for approximately 20% of all deaths each year worldwide, and the numbers and percentages of deaths are projected to increase at unprecedented rates. In the United States, CVD has been the number one killer every year since 1900, with an estimated economic cost of approximately $300 billion annually. A cerebrovascular disease is any disease resulting from the obstructive effects of atherosclerosis in the arteries that supply blood to the brain. A stroke is the loss or impairment of bodily function resulting from injury or death of brain cells after insufficient blood supply. Strokes are a fairly common killer in the United States. They represent the third leading cause of death, behind CHD and cancer.
Hypertension is persistently high blood pressure, which either may have a known cause or may be associated with other primary diseases. Individuals who regularly perform exercise at intensities between 40 and 70% of aerobic capacity demonstrate fewer incidences of hypertension than inactive individuals. Diabetes is a chronic disease caused by the deficiency in the production of insulin, or in the use of insulin to transport glucose from the blood into other tissues, thereby resulting in the excess glucose in the blood. There are two types of diabetes. Type 1 diabetes typically develops in childhood and is characterized by the failure of the pancreas to produce insulin. Type 2 diabetes is more common than type 1 and occurs due to insulin insensitivity. A way to prevent type 2 diabetes is by diet, weight loss, and physical activity. Osteoporosis is a disease characterized by abnormally low bone mass and the deorientation of bone tissue that can lead to increased risk in fractures. Osteoporosis can occur in men, but is more prominent in women after menopause.
Cancer refers to a group of related diseases that result from the uncontrolled growth and spread of abnormal cells. Approximately 50% of men and 33% of women in the United States will develop some sort of cancer in their lifetime. Although there are many different types of cancer, all forms occur in two general phases, initiation and promotion. During the initiation phase, normal cells are changed into potentially harmful cells by damage from mutational factors. During the promotion phase, tumor growth is stimulated by other agents such as hormones. Approximately $150 billion is spent each year on mental health in the United States. Depression is one of the most common mental health problems, and it is estimated that 50% of the suicide deaths in the United States each year can be attributed to depression.
One of the most important measurements in exercise epidemiology is the incident rate. An incident rate is the frequency or number of events that occur over a defined time period, divided by the average size of a population at risk. There are three general categories for incident rates: crude rates, specific rates, and standardized rates. Crude rates are based on the total population without considering any of the population's characteristics. A specific rate involves the computing of the incidence rate for each subgroup of the population. Standardized rates are the crude rates that have been statistically adjusted to the control for the effect of the population's characteristics. Cross-sectional surveys measure risk factors in the presence or absence of a disease at the same time. Although these studies are relatively inexpensive, they cannot determine potential cause and effect relationships. Cross-sectional surveys are typically used to generate hypotheses regarding relationships between risk factors and diseases. They can also be used, however, to assess the prevalence of risk factors in a specific population.
Prospective cohort study is a study in which the subjects are randomly selected from a defined population, and baseline information is collected regarding potential risk factors for the disease of interest. The subjects are then followed over time to track the incidence of the disease. Prospective cohort studies usually are very costly and much more time-consuming than either a cross-sectional survey or a case control study.
The randomized controlled trial is considered the gold standard for testing a research hypothesis because it gives the researcher more control than any of the other research designs. In a randomized controlled trial, the subjects are randomly assigned in either an experimental group or a placebo group. Both groups are tested before and after the intervention to determine whether the intervention had an effect when compared to the placebo. Thus, the most important factor is that the subjects are randomly assigned to an experimental and placebo groups. Randomization ensures that both groups possess similar characteristics. Thus, any differences noted between the two groups for any particular factor can be attributed only to the intervention being studied.
Professionals in exercise epidemiology were employed in a college or university setting, where they taught courses in exercise epidemiology and conducted research in their areas of interest. Increased growth in the area of exercise epidemiology has created more employment opportunities in colleges and universities, as well as in nationally funded organizations such as the U.S. Department of Health and the CDC. Furthermore, individuals employed in health and related fitness settings are indirectly involved in exercise epidemiology. This includes personal trainers, YMCA directors, health club owners, strength and conditioning specialists, and physicians.
The American College of Sports Medicine offers a number of clinical and specialty-based certifications available for those interested in pursuing a career in exercise epidemiology. These certifications include Certified Clinical Exercise Specialist, Registered Clinical Exercise Physiologist, Certified Cancer Exercise Trainer, Certified Inclusive Fitness Trainer, and Physical Activity and Public Health Specialist. There are also a number of professional associations that exercise epidemiologists can be a part of, which are listed below.